For what I tell my patients is the number one reason that patients lose hair is they're stressed. Okay, what does stress do? It raises cortisol, the most important hormone of the body. What is cortisol? It's the hormone of stress. What does cortisol do? Blocks the receptor. All right, so now you take a patient who is perfectly balanced, estrogen, progesterone, testosterone are balanced, they're doing great, and they have a catastrophic event. Their husband dies, the kids get into an accident, something terrible happens. Their cortisol levels go up, they'll start having symptoms of hormone deficiency. So the answer there is not to increase or change the hormone dose, it's to address the stress and help to lower the cortisol.
Welcome to Restoring Your Roots and Confidence. Today, we're so excited. We're joined by a special guest, internationally recognized Dr. Jack Monaco, who is recognized for his hormone expertise, as well as his anti-aging and medication and non-medication for helping those balance their hormones, men and women alike. So today, as I introduce Dr. Monaco, I want to take a minute and go old school and read a little bit of his bio to you. So Dr. Monaco graduated from Bowman Gray School of Medicine in North Carolina with a doctorate of medicine, while completing his fellowship with the American Academy of Anti-Aging and Regenerative Medicine. Additionally, he is also a board-certified OBGYN. Dr. Monaco has been awarded multiple prestigious awards, including Connecticut Top Doctor Award and Excellence in Clinical Teaching and Training. So, without further ado, we have a great show, and I want to welcome Dr. Monaco. Thank you so much for being here today.
Thank you, Kimberly, for having me.
Yeah, well, we're excited to jump in. We have a big show, and we're talking about testosterone and the effects of what testosterone does and how it plays a key role in our hair loss and also our overall health. So, tell us about it.
Well, you know, it's very interesting. Testosterone is very misunderstood and often misused. Testosterone is really more than just a sex hormone. We tend to think of testosterone only for libido, but it has so many other benefits for regulating blood sugar and clearing cholesterol, building strong bones, muscle energy, cognitive function, prostate health, believe it or not, and more than just libido. So we tend to think that if your testosterone level is normal, there's no problem. And really there are optimal levels of testosterone, and there are things that interact with testosterone that need to be addressed as well.
Well, and we know, testosterone is near and dear to men's hearts for sure. But we see it across the entire spectrum in our hair loss clinic. And I think what's so misunderstood is, why is testosterone so important to hair loss, and how does it really affect, outside of the libido, all these other functionalities that you just described?
Well, testosterone is a growth hormone. Okay, that's what the term androgenic is. Androgenic is testosterone. And you have catabolic hormones and you have anabolic hormones. And anabolic hormones are those hormones that stimulate growth. So the hair needs to be stimulated to grow. But like all hormones, too much of a good thing, or if it's not properly balanced, can be detrimental. We also have to talk about the receptor, and we can talk about that in a few minutes. It's not simply the level of testosterone that makes a difference. It's really how that is interacting in the body with the receptor. It does you no good to have a lot of testosterone if your receptor is not responding.
So then, with just narrowing into talking about those receptors and the androgen receptors and the hair follicle, so how is that testosterone really making a difference? Because, we talk about, the common word DHT, right? Dihydrotestosterone. So there's a lot to unpack here. And just for men, how does this really function, and what do men do to really make a difference in this?
Well, you know that testosterone, when it's elevated in women, will cause hair growth. So it does the same thing in men. Now, DHT DHT, dihydrotestosterone, is a metabolite of testosterone that's about 3 to 5 times more potent at the receptor. But DHT has also been implicated in male pattern baldness as well as hair loss in women and in prostate enlargement. The amount of DHT in the blood doesn't necessarily correlate with some of those things. So it's more than just having DHT in the blood. That DHT has to be converted in the hair follicle from testosterone. And there's an enzyme that does that conversion, and that enzyme is under genetic control. So just because you have a high level of DHT, it doesn't mean that you're necessarily going to lose hair. As we get older, our hair follicles become less sensitive and we tend to thin our hair. I can tell you that when I look back at my medical school graduation, I had a very different head of hair, but I still have a pretty good head of hair.
Right.
Okay? And it really has to do with the genetic activity of that enzyme, and that varies from patient to patient.
And the enzyme that you're speaking of specifically is 5-alpha reductase.
That's correct.
Yes. So I think, that enzyme has really gained popularity over the last few years just because of the FDA clearing the new alopecia areata drug, which is an autoimmune form of hair loss. So when we think about that, and we know from at least all of the information that's on the World Wide Web about 5-alpha reductase medications lowering the immune system or causing effects to the body, how does that, if we're supporting it or we're trying to help and boost or either downplay the 5-alpha reductase 5, depending upon where that enzyme is in its development, how does that make a difference then for genetic men's thinning? I mean, could that medication be used for someone such as a 25-year-old that is just having genetic hair loss?
Yes. Now, the thing is that that the hair loss in men is linked to the mother's side of the family. So for guys, you want to look at your maternal grandfather, and that'll give you an idea of what your hair might look like when you get older. I was very fortunate. My maternal grandfather had a full head of hair. My father's father was bald as a cue ball. Okay, so I'm following that genetic lineage. That's just the way it is. But we can also reduce that conversion using 5-alpha reductase blockers, okay, commonly known Propecia and Avodart,
yes,
finasteride and dutasteride. So there are different medications that we can use, which I use quite freely in my practice to help regulate that level of DHT. But again, the level of DHT doesn't necessarily correlate with hair loss and prostate enlargement. It's
right.
A little bit more complicated than that.
And does the DHT in the body, then does it also correlate with any forms of heart issues or coronary issues? Has there been any tie there that, if we find that someone is having hair loss, are they more prone or more apt to have other health conditions?
Not the DHT directly, but the testosterone and estrogen. So
Okay.
when you look at some of the studies, the one study that I found looked at cardiovascular events in men over the age of 60 and correlated that with the level of estradiol. So a man's estradiol comes from testosterone. We don't have ovaries, so we can't make it. So we have testosterone going down another pathway to make estradiol. We know from that study that a level in the blood between 20 and 30 is optimal. When you go very low or very high with estradiol, you start to see an increase in cardiovascular events. We also know that all-cause mortality in men is associated with low testosterone. That doesn't mean that testosterone causes those problems. It's an association, including prostate cancer. So when you look at the literature on prostate cancer, for instance, men with prostate cancer, a high percentage of them will have low iodine, low vitamin D, and low testosterone.
Interesting.
So there are health benefits to testosterone besides libido.
Right, right. Well, that's good. So when we're talking a little bit mostly or focused here on men, but let's think about women and the importance of testosterone in their bodies regarding hair. So you mentioned a moment ago that, if the testosterone levels are too high in women, we see hair growth in areas that we do not want. We also can see individuals experiencing PCOS, right, and polycystic ovarian syndrome, depending upon the levels of the testosterone. So in our clinic, and we consult with you on this frequently, is that we will see women that have been given hormone replacement therapy and they're starting to have aggressive telogen effluvium shed, so meaning that very aggressive acute shedding. For the listener, I mean, does that mean that the testosterone is too high, or does it just simply mean that the hormones overall are not balanced?
Okay, there's a lot of information that came out of that question.
Okay.
So the first thing is that with PCOS, testosterone doesn't cause PCOS. Testosterone is the result of PCOS. So when you look at women, you need to know where their testosterone is coming from because they don't have testicles. Okay, right. So 50% of a woman's testosterone comes from the ovary, and the other 50% comes from the adrenal glands. Now, the hormone in the adrenal glands that makes testosterone is called DHEA. Okay, so people that have PCOS often have high levels of DHEA. The part of the ovary that makes the testosterone is called the stroma. So you have basically two components of the ovary. You have the follicles that make the egg so a woman can conceive and makes estrogen and progesterone. And then the stromal portion of the ovary is what makes the testosterone. So when a woman goes into menopause, her estrogen and progesterone levels go down. Now, estrogen and progesterone are anti-estrogenic. So they oppose the actions of testosterone. Okay, right. So a postmenopausal woman who doesn't take hormones, her testosterone level from the ovary may be lower than it was premenopausally, but because she's low in estrogen and progesterone, she can get more of the effect of testosterone. The classic example is the little old lady who doesn't take hormones and she starts getting a mustache and hair along her face. By giving hormones properly balanced, you can offset that effect. Okay, some women are genetically more predisposed to grow hair. Take the Mediterranean woman versus the Scandinavian woman. Okay, their testosterone levels aren't necessarily different, but the genetic response to the testosterone at the hair follicle is different. Okay, now you look at hair loss. These hormones are addictive. People feel good on these hormones. Okay, and a lot of the conventional wisdom and the way I was taught before I became enlightened was if somebody has symptoms, you give them hormones. The symptoms go away, but then the symptoms come back. What do? You increase the dose. All right? You get an effect, the symptoms go away for a short time, and then they come back again. You increase the dose. And what's happening is that receptor is shutting down. It's trying to protect us from too much hormone. All right? We call it receptor downregulation. Okay? So in that situation, when you see a patient who is symptomatic, has high levels of hormones, the knee-jerk reflex to increase the dose is incorrect. You need to actually decrease the dose. It's kind of like water in your lawn. Okay, if you have an irrigation system and your irrigation system is not paying attention to the fact that we're having a monsoon in the spring in Middle Tennessee, that lawn gets saturated and it doesn't grow more, it actually grows less. So once the sun comes out, you wouldn't go out there and turn the sprinkler back on again. You would let the lawn dry out. That's what we have to do with hormones. So balancing those hormones and getting the proper dose is critical. That varies from patient to patient. There's no one size fits all. So we have to figure out with each patient what the dose is. Now, when it comes to women, why is testosterone important? Helps to clear cholesterol, helps to regulate blood sugar, helps to build strong bones, okay? Gives us energy, builds muscle. Muscle burns fat or burns energy more than fat does, so you're going to help with weight management. help with cognitive function. You have estrogen receptors everywhere in the body. Okay, so these hormones are really very important. And stress is a big factor. From what I tell my patients is the number one reason that patients lose hair is they're stressed. Okay, what does stress do? It raises cortisol, the most important hormone of the body. What is cortisol? It's the hormone of stress. What does cortisol do? Blocks the receptor. All right, so now you take a patient who is perfectly balanced, estrogen, progesterone, testosterone are balanced, they're doing great, and they have a catastrophic event. Their husband dies, one of the kids get into an accident, something terrible happens. Their cortisol levels go up, they'll start having symptoms of hormone deficiency. So the answer there is not to increase or change the hormone dose, it's to address the stress and help to lower the cortisol. And we can do that.
Well, and I know many times when we've sent clients over to you, that is one of the first areas that you look at is their cortisol levels. And, you know, during, gosh, I've been in this industry for so many years that we see clients for, 15 and 20 years. And the trajectory is a little bit like a roller coaster. Life will be great and everything seems to be smooth. Hair growth is good. Texture of hair looks great. The hair's bouncy and fluffy. Even if somebody's getting older, and they think, well, I'm aging, but my hair's in a good state. And then all of a sudden, right, something catastrophic happens in their life, or it's a major illness, or it's a major shift in some form of stressor that causes that. I guess now that you're sharing all this with us, that imbalance then of the hormones.
Well, women also, you mentioned the roller coaster. Women also experience that hormonal roller coaster as they're transitioning to menopause. Now, in gynecology school, we're taught that perimenopause is a year or two before menopause, and the average age of menopause in this country is age 50, but the range is 45 to 55. These hormonal changes, however, begin in the mid to late 30s. So typically what's happening is the ovary is starting to become refractory to the signals from the pituitary gland. So hormone levels are fluctuating. You're not ovulating. Your ovulation is not as normal and as optimal. Progesterone levels are falling. You're losing the balance of estrogen and progesterone. So the brain is trying to stimulate the ovary to make more hormone. Well, what's it doing? It's stimulating the part of the ovary also that makes testosterone. So initially, a woman's testosterone may go down as she approaches menopause. That stimulation causes her testosterone to rise. And I can see the testosterone go up, and it even overshoots. And then after menopause, it'll drop down again. So sometimes I'll see patients and their testosterone levels are normal or even a little bit on the high side. That's probably because of that phenomenon. We test them again 6 months or a year later, and their testosterone levels may be in the toilet. Okay?
Right.
So we have to follow those levels.
So speaking of testing, how frequently, if a male or a female is having any of the signs or the symptoms that you mentioned of perhaps maybe irregulation in their hormones or testosterone, how frequently should those levels be checked and tested, whether you are taking replacement therapy or any form of hormone supplementation or not?
If I get patients, or not if, when I get patients balanced, then I'll test them once a year. Some patients request being tested every 6 months, which is fine. In the beginning, until I'm getting these levels adjusted, I may be testing more frequently. Now, there are different ways to replace testosterone in men. The most common, and I think the best way, is injectable. But the conventional way of doing injectable in men is to give a large dose of testosterone every 7 to 10 days. So in the first day or two, the testosterone levels are very high, and the guy's like a raging bull.
Right.
And then at the end of that time, the testosterone levels are very low, and he's kind of struggling. So you get these wide swings. So men can go through this hormonal roller coaster just like women do. Okay. In women, we test them in the saliva because we're using topically applied hormones. Topically applied hormones are not seen accurately in the blood, and that's a mistake that a lot of conventional docs make. They'll give a topical hormone and do a blood test, and they don't see it in the blood, so they raise the dose. Okay. And that came about from the studies because you see about a 10% increase in serum levels with topically applied hormones. So the drug companies and the doctors say, well, you only absorb 10% of that topical hormone. So the obvious question is, what happens to the other 90%? Where does it go? No, it gets absorbed. Okay, but in men, I can regulate their hormone levels very, very nicely by twice weekly injectable. We use 2 different forms of testosterone that have a little bit different absorption properties and peaks and so on, and we get very, very smooth curves. My guys, if they inject on Monday and Friday, they don't feel any different on Wednesday or Thursday or Tuesday. They feel pretty stable, and we're keeping the testosterone levels in a very tight physiologic range rather than this high and low swing of testosterone.
Well, and relating to men or to women, when you talk about those high swings, we're also thinking about the stress that brings upon our body, right? So then this, chronic hair loss that we see for individuals after they've come off an acute stress trigger or event in their lifetime, we keep seeing this chronic loss. And that is the hardest for us to dive into and get to the bottom to, of determining what really is going on. Because then we also are thinking of, could it be a thyroid issue?
Absolutely.
Can it be other underlying health issues? Could it be an autoimmune issue?
Absolutely.
Right? So it's so complex when we're talking about hair loss. It's crazy.
Yeah, pretty simple, isn't it?
Yeah, right. Sure,
So,
we can just sit here and work it all out
but
today.
you mentioned thyroid, so there's iron that you have to consider. There's protein. Often you'll give branched chain amino acids because you're trying to generate protein and you need amino acids to make protein. People could have an absorption issue. So they may be eating things, but they're not absorbing their nutrients, or they have leaky gut, or they have, like you said, an autoimmune condition. So now you've got the body attacking things that were not supposed to be attacked. Okay, and conventional wisdom, again, is let's suppress the immune system, which is not really the answer. You want to investigate the gut because 90% of our immune function is in our gut. So when you look at hair loss, whether it's male or female, simply getting those levels balanced is just one part of it. It really becomes very, very, it's what I call it's clear as mud. It's very individualized too.
Completely, which is also the reason that, 99% of all of the clients that come to see us that are really serious about helping and slowing the hair loss, returning to hair growth that they had years before, understand that we become their coach and that this isn't a one-time visit. Yeah. We are with them for their life until they feel that they get back on a normal plane, right? Yeah. And then we might see happens, them, right? And then we might see them once a year. Yeah. Or at least, though, for you as well as for us, we feel like that we offer a safe place with education, right? And a foundation of why we're treating and what we're treating with so that it really does, at the end of the day, make a difference.
Yes, it does.
So to leave our listener with, tell us, and I don't know, maybe there's not an answer for this, but are there levels that we should be thinking of when it comes to testosterone levels for men and testosterone levels for women independently? So meaning, right, somebody's listening to us from New York and they say, okay, I'm going to go have my testosterone levels checked. Well, you might give them a range if it's a male at 25 years old and he goes, oh, I'm spot on, but he's still seeing a lot of hair loss. So certainly we know that could be a genetic predisposition. But has he really checked the other levels that could be contributing to the hair loss?
Well, the rule of thumb in functional medicine is we're trying to optimize those levels into the upper third of normal. Okay. So you take a guy, for instance, there's total testosterone. It's a number. It's the amount of gasoline you have in your gas tank. All right. So if you have a full tank of gas, it doesn't mean that your engine is running. Okay, so now we have to talk about the breakdown of testosterone. Conventional wisdom, they'll do a total testosterone. The range for the laboratories here is 250 to 1100. All right, so if your testosterone is 260, technically it's in the normal range. And a lot of guys are told, well, your testosterone is low, but not low enough for me to treat, or it's still normal. Okay, well, you want to know not how much gasoline you have in your gas tank, although that's important. You want to know how much of that gasoline is octane? How much of it is ethanol? How much of it is water and other hydrocarbons? So in testosterone, you've got free and bioavailable testosterone. So you see these ads on TV. Oh, take our product here. Your girlfriend or your wife will love it. And it raises total testosterone, or it raises free testosterone. So what does that mean? Testosterone, like the other hormones, are fat soluble. So they have to be carried on carrier proteins. Okay? You don't do that, you precipitate it out in the blood, you clog things up, and you die. Okay? So the main carrier protein for testosterone in men and women is sex hormone binding globulin. All right? The problem with SHBG is that when testosterone binds to SHBG, it's so tightly bound, it's essentially irreversibly bound and out of the equation. So let's say that you have a man has a testosterone level of 600. About 60% of that is irreversibly bound to SHBG. The other major protein that carries testosterone is albumin, egg whites. Okay? So albumin binds the testosterone, but more loosely. So now the testosterone can come off the albumin carrier, get onto the receptor, the androgen receptor, and stimulate the cell to get the effect of that testosterone. It's biologically available to do the job. That's the bioavailable fraction. And then about 2% is free. So about 38% is bioavailable and about 2% is free. So when we look at testosterone, the total level of testosterone is important because that can affect levels of DHT and estradiol. Obviously, the higher your testosterone is, the more conversion you're going to get to those other compounds. But I'm looking at the free and bioavailable. Okay, and there are optimal ranges. So when we talk about functional medicine, we're talking about dysfunction. Okay,
right.
So what does dysfunction mean? Imagine you have a car that has 8 cylinders and 2 of them are fouled, but 6 are working. Your car's still going to run. It's just not going to run very well. That's dysfunction. All right. So a guy, the total testosterone is important, but if the total testosterone is a little bit on the high side, that doesn't trouble me because I'm looking at the free and bioavailable. Now, the way the system is designed, as your total goes up and these other levels go up, the body wants to protect us. So what does it do? It raises SHBG. And one of the things that raises SHBG is estrogen. Where does the estrogen come from? Testosterone. High level testosterone, higher level of estrogen, higher SHBG, lower free and bioavailable. So it's really a balancing act. Women, it's not quite that difficult, okay, because we don't really look at free and bioavailable because that's not their main hormone. Right. But we do look at testosterone levels. And by the way, in a woman, the first sign of too much testosterone is not hair loss or hair growth. It's actually oily skin and acne in most cases. All right, you don't typically see that effect of testosterone with the hair until it gets higher. So then you ask yourself the question, does that woman really have a very high level of testosterone? Now, I'm going to reverse what I just said in one instance. In PCOS, I do look at the free testosterone level because I've seen patients with normal total testosterone, but they have a high level of free testosterone. And that's really the active hormone. That's the active fraction of the total. So in women, we'll be checking saliva. In guys, we're doing blood work.
Okay. And then, so are there levels that as the listeners and the viewers go back and check, what are those?
All right.
Can you give them like a gradient or kind of a range?
No, I go over each test with them. So we do salivary testing. We're looking at estrogen, progesterone, and testosterone. Okay. For the testosterone, the normal range for women is 16 picograms to 55 picograms. Okay. I like to get my patients 40, 45, 50, right up in the upper third. Okay. We have the same thing for estrogen and progesterone. Okay. So there are those ranges that we look at. In guys, the total is 250 to 1100 for most laboratories. I've seen some laboratories where it's a little bit lower. Okay. But again, if you just break it into third, you want to try to get them in the upper third. So in a lab where the upper normal is 800, the upper third may be 700, but in a 250 to 1100 range, that's on the lower side. You see? So you look at the upper third. Now, for free and bioavailable, same thing. We want to get them into the upper third of that range. Okay. I will tell you that it's not uncommon for a woman to get contaminated with testosterone from her spouse or her boyfriend or whoever who's using topical testosterone. So topical testosterone is a way to measure or to restore testosterone in men. I used to use it. I don't use it anymore for a couple of reasons. One is we weren't seeing the effect. Two, it's a little bit harder to regulate, I think. Three, you have to do salivary testing, which is an out-of-pocket expense for people. So insurance companies will pay for blood testing, but not for salivary testing. And fourth, you can contaminate people. Okay. Another source of contamination for women is a public gym. So you go to a public gym and you've seen these guys in there that are strutting around, lifting heavy weights and slamming the weights. Okay. They're lathering up testosterone in the gym or in the locker room. They go out and everything that they touch is contaminated. Because how do they put it on? Put it on with their hands. So when we apply topical hormones, we never use the hand. We always use an applicator. Okay?
Oh my gosh. I never even thought about that.
Okay.
That is the wildest thing. And I was just at the gym last night. It's a private, smaller gym, but still.
When I used to go to the gym, okay, I would wear long pants, never wore short pants. Not because I don't have nice legs, but because I didn't want my legs exposed. Okay.
Everybody know.
I wore
Dr.
high
Monaco
socks.
has good legs.
I wore high socks. Okay, too much information. I wore high socks. I wore lifting gloves. I didn't wear long sleeve shirts, but I didn't wear
Oh, yeah, the cutoff, muscle
sleeveless,
shirts, sleeveless, yes.
Whatever you want to call them. And I was the guy walking around with the spray bottle and the paper towels, and I was wiping everything down. I was wiping the seats down, the handles on the equipment, even the handles on the dumbbells. Okay, wiped everything down because I didn't want to get some guy's testosterone.
Sure.
And I've seen women, their testosterone is sky high, and then as soon as we address those issues and she removes herself from that situation, her testosterone levels come down.
Yes, I know. Classic. About a year or so ago, I know we had a common client patient, and you had shared something similar with that, and it just had never dawned on me. So I do think for the men and women listening today, just I think be aware of this transfer for your partners for sure. Wow. So you've given our listener just so many amazing things to think about, but I think we're just that much more confused.
But there's so much to this, and that's why we tend to simplify it in conventional medicine. Oh, here, take this androgel, or take this Axiron, or take this, and just put it on every day. And what do they tell them to do? And I heard a urologist say this to an audience that I was a lecturer, and I'm sitting in the audience listening to this, and he's a very well-respected urologist, written a lot of good research. You put on your shoulder, you put the topical testosterone on your shoulder, but you have to wipe it off after an hour because 90% of it is still there. So he was thinking that it was only 10% absorbed. First of all, you never put it on with your hand, because what do? The first thing you do when you put it on with your hand, you wash your hands. Well, how do you turn the faucet on? With the hand that's contaminated with testosterone. Then you take the soap, you wash your hands off, and you turn the faucet back off again. Now it's back on your hand. Then you go to the towel and you wipe it on a towel. Now it's in the towel. Okay?
Yes.
Who does the laundry in most cases? Your wife. So what is she doing? So she doesn't have to get direct contamination from you, but it could be secondary transfer. So it's really important to and we spend a lot of time educating men and women how to do this. I do have a few guys that do really well with topical. They don't want to do injectable. That's fine. When I was taking care of patients in a nursing home with their hormones, I wouldn't use topical hormones because you can't trust the staff there or the patient to do that. And you can't do salivary testing. So we would give them troches. It's a lot easier for a nurse's aide to say, here, put this in and let it dissolve. And then we would do blood spot testing. So capillary blood is a pretty good representation of the salivary hormones. All right, post-capillary blood, when you do a blood test, you draw from the venous side of the circulation, the hormone's already gone.
Well, and I can just tell you, I wish you could develop something like that for women, because every time that I am asked to give a salivary test and a saliva test, oh my gosh, I dread it. And I don't know why, because I feel like I'm a pretty hydrated person and I'm in good health. But boy, in the mornings, to spit that much saliva in that little tube just about kills me.
Well, it's really a matter of technique, okay? So we have you rinse your mouth out. okay, and hydrate your mouth. You can drink water. There's no problem with that with salivary testing, okay? It doesn't have to be done within 30 minutes of waking. That's only for the adrenal test, okay? So it just has to be done 12 hours after you apply your hormones. Sometimes rolling a marble around in the mouth will make you salivate. Okay, so but there are some medications that patients are taking that do dry their mouth out. We can do blood spot testing for those people.
That's great.
It's not as good, but it's close.
Well, that's good to know. Thank you. Thank you for that. So I think then, just in conclusion, I mean, we've talked about so many different ways that testosterone really can affect men and women, not just with hair loss, certainly across the entire holistic health system, right, of their bodies. But I think more than anything, it's just important for everyone to stay on top of this and to realize one hormone is not isolated as its own. It is a combination approach of all the other hormones.
That's right. So you have to look at the adrenals and the thyroid. But, the take-home points might be hormones aren't bad. It's how they're given that creates problems. There are a lot of other benefits to testosterone. Okay, diabetic men, this was a study done on diabetic men, they had better carbohydrate control when they optimized their testosterone. We know that testosterone helps to clear the cholesterol. So that's a positive, okay? There's a lot of positives to testosterone if they're properly done. Anything, even oxygen, if it's given too much in certain situations, can be detrimental. So it's really more than just looking at a number. It's really about interactions with the receptor, interactions with other hormones, proper balance, and things like that.
Good. Well, thank you again for such a wealth of information. And so if you have a question regarding your testosterone or your hormones or anything that Dr. Monaco's team or the HPIHair team can help you with, don't hesitate to go ahead and reach out to us at the email that's connected here on either your listening preference of your podcast or if you're watching us via YouTube. And if you don't see that, it is info at HPIHairpartners.com. And we'll make sure that we distribute those emails directly over to Dr. Monaco and his team. As always, thank you so much for listening. We can't do this without you. We do need your questions and we do need your input because that helps us create more content that you're interested in. So don't forget to subscribe today. And as always, make it a great hair day. Bye-bye.